Good afternoon and happy Thursday. I hope folks are doing well. It's really exciting to see the number of participants go up. Welcome to LCHC's virtual data and policy briefing for 2024-2025, the State of Latino and Indigenous Health in California. We're really looking forward to sharing the rich findings of our recent community listening tour with you today and making the connection to our legislative and advocacy priorities. My name is Rosa Flores. I use she, her pronouns, and it's my pleasure to moderate today's little lunch and learn session. As I mentioned a little bit earlier, we'd love for folks to introduce themselves in the chat, so please feel free to drop your name, organization, and location, wherever you're joining us from. Excited to see all of you here. So we'll go ahead and get started with a quick overview of our agenda. We only have an hour together, so our executive director, Dr. Cecia Aquino, will help us set the stage, followed by our wonderful research coordinators, Ariana and Domingo, who will review health priorities by region. And finally, we will be joined by Marveles, our director of policy, who will walk us through what to expect in the upcoming budget and legislative advocacy work. We're hoping that time allows for some Q&A. So as the hour progresses, please use the Q&A feature to send your questions, and our staff will be taking note. For any questions that we do not get to today, we will be sure to follow up. So please do use that feature. Lastly, a reminder that we will be hosting a multilingual community report back in the near future, and today's session will only be hosted in English. Once again, thank you to our presenters, if we could go to our next slide, for their time. Dr. Aquino, Domingo, Ariana, Mar, really happy to have you with us today. And shout out to all of the other folks who make this possible, our Health Justice Fellows and our LCHC staff behind the scenes. Cecia, over to you.
Thank you so much, Rosa. Muy buenas tardes, and thank you all for joining us today. As you know, the Latino Coalition for a Healthy California was established over 30 years ago, and our mission and vision remains that vision to end Latino health inequities in California, to ensure that we all can live dignified and healthy lives. The way that we do our work is through policy. So our main focus of work is to make sure that our people power, our legislative and administrative advocacy, and our narrative change as departments, as systems, as the way that we are implementing the work are carrying out that systemic change that we need to see long-lasting changes. In California, Latinos represent over 40% of the California population. We are the largest racial and ethnic group in California, and we're expected to continue increasing. By 2050, we'll be 50% of the population. We make up 51% of California children and 43% of working age adults. So when we're talking about the power of California, California being that 5th largest economy in the world, we are talking about Latinos. Unfortunately, we are faced with some difficulties, and I'll go through a couple of disparities that our communities face. Latinos in California are more likely to be uninsured at 11%, but we have the highest Medi-Cal coverage. In 2024, we saw that 51% of Medi-Cal recipients were Latino, and 28% of our CalFresh recipients were Latino. What does this mean? That means we have coverage, but how effective is our coverage? How accessible are we making these programs so our communities can actually utilize them and either show up to the clinic for those services or get those food benefits? Unfortunately, we are seeing that food insecurity is very common amongst our community. At 33% of Latina households with children experiencing food insecurity in 2023, and nearly twice as many Latina families with children experiencing housing instability than white families in California just in the recent years. So we see how our health is affected by all other social economic factors, right? And how across the social determinants of health, our community unfortunately faces those disparities. How are we walking into this year? our current Latina health is fragile. We are still recovering from the COVID-19 pandemic. During the pandemic, we saw over 42,000 COVID deaths and 4 million COVID cases within the Latina community. We are still recovering from those acute cases, long COVID, the socioeconomic disparities that were exacerbated, and actually the pandemic decreased our life expectancy by 3.0 years. So Latina health is in such a way that we need to be very careful and intentional in how we protect it. We're still, and our community is still facing the chilling effect from the first Trump presidency. We're seeing disenrollments that we saw during the past unwinding, and of almost 2 million disenrollments that we saw, of those 2 million, 50% were from the Latina community. We're also facing this year with decreased protections that we had under the pandemic era relief policies, which we know pulled communities out of poverty. And at the US level, 12 million people were lifted out of poverty through these protections. And we know that these protections focus on health and the safety net. So as we continue to think about how do we address these disparities, we need to focus on those systemic solutions that focus on health and the safety net. What can we expect this year? As we know, with the current administration, our communities are facing a great amount of fear. What we're seeing is actually what LCHC is coining a fear pandemic. Our communities are facing a quarantine. Our parents, our tias, our abuelitos are scared to leave our homes. They're actually staying indoors, afraid of being picked up if they go outside. So day-to-day lives, like walking a dog or going to work, are not feasible for our community at the moment. And so we're seeing this fear really impact. We know that we're still recovering from the chilling effect. Well, now we can expect a chilling effect times 2. It'll impact all of our systems from health to the safety net. Additionally, with this chilling effect, it's not just an impact on the individual. We are now seeing systemic impacts that are coming through specific policy changes, and our existing infrastructure is being fiscally impacted. Our mental health and behavioral health will be affected. Not only were we already experiencing disparities across the community when it comes to these two, but now with the increased fear, anxiety of the future, mental health and behavioral health will be areas that we need to focus in. Those exacerbated health disparities will continue to be exacerbated during everything that we face with this administration. Our climate crises, like the devastating fires that we saw at the beginning of this year, impact our most vulnerable. And that means that our community, the Latina community, is disproportionately affected by this. And as we look to the social determinants of health, housing, displacement, food insecurity will be key to keeping folks safe. I want to walk us to this thought. Health is a sound investment. The economic theory of human capital tells us that if we keep folks healthy, folks can show up to work, can show up to school, and can actually be a healthy contributor to the economy. So in California, if we want to stay at that number 5 leading economic power in the world, then we need to invest in Latino health and social services. Latinos contribute over 83 billion in state taxes. So what does this mean? We need to meet the moment by meeting both acute and long-term needs. So with our acute needs, we need to continue gathering data that is reflective and timely, like this listening tour and the information that you will receive in just a few moments. Our community education and know your rights work needs to happen, and in both Spanish and Indigenous languages. At LCHC, we have a network of promotoras through our Pasa la Voz work, which means our community receives information in a timely manner as we're hearing of the news, be it the devastating fires or the different fears that the Trump administration is throwing our way. We also have our regional power hubs network. So we have brought together over 16 groups that are Latino and Indigenous led and serving to make sure that our communications and rapid response network is reflective of our community and is activated to meet the needs. Acute needs through policy. What do we need to look forward to? No cuts, no rollbacks when we talk about health for all, those Medi-Cal expansions for our communities. We need to continue to invest in the safety net. That means no delays for food for all, investing in legal protection for immigrants and our mixed status families, and protecting the privacy and information of our communities. No longer can we throw out blanket statements that say, you can show up to your clinic or to your appointment without fear of being attacked or picked up. That's no longer a reality for us. So we need to make sure that families have access to their rights, to the utmost information that they need to make a decision for themselves and to protect themselves. But what are we doing within our systems, within our clinics, to make sure that their privacy and their safety is of #1 priority? And long-term solutions. We can't lose our eyes. Many difficulties will come our way that are acute needs, but we need to think about the future. We need to keep an eye on the future. So what are these long-term solutions? LCHC is proud to have this long-term solution. This year, we'll be launching our Latino physician shortage campaign, making sure that we're tackling that long discussed but poorly addressed issue of the Latino physician shortage in California, making sure that we raise that number to more than 6% of physicians. And when we talk about the workforce, not just physicians, but across the public health and healthcare delivery system, we need Latino and Indigenous providers that know the community, that know the needs, and can serve in a culturally competent way. So today, we'll be able to share with you more about how our communities are communicating about these barriers, and we'll end our time together with some policy solutions that we can advance. Thank you.
Thank you for setting the stage for us, Cecia. Please continue to use the chat to introduce yourselves. We realized there were some technical issues, but would a webinar be without a couple of hiccups? But thank you. It's super great to see a lot of our partners. I saw Planned Parenthood. I saw Hijas del Pueblo. I see medical students, Cielo, CVDIO, different offices. Thank you for joining us today. So Cecia shared about one of our main projects being a listening tour, and I'm going to bring us back to the data that we're going to be covering today and give you some of the background on this annual project of LCHC. So every year we organize and conduct a listening tour to better understand the needs of our community. And essentially this ensures that we are keeping our ear to the ground and holds us accountable to the folks that are most impacted by health inequity. And so what this looks like is we host small group discussions of about 20 folks in each of the different regions that you see on the screen there. So Sacramento, Central Valley, the Inland Empire, San Diego, the Bay Area, Central Coast, LA, and Orange County. And we meet with folks and discuss a number of topics. Ultimately, this information is used to inform our policy priorities and our policy agenda for the incoming year. Next slide, please. So what do we cover in those 2 hours, you might be wondering? We talk about a lot. We talk about issues, of course, related to healthcare, mental health, oral health, maternal health, child health, reproductive health, sexual health. But just as importantly, we seek to understand how folks are experiencing the social determinants of health, which is to say the non-medical factors that affect health outcomes and people's livelihoods, like access to healthy food, housing, education, having clean water, clean air, employment, et cetera. And then we also seek to understand how folks are experiencing recent policy changes. This last round, we really wanted to understand how the expansion of Medi-Cal was impacting our communities, and we found some helpful information. and we're happy to share that briefly. Next slide. And I would be remiss not to extend a really deep, heartfelt thank you to all of our partners who made this possible. Ella para Trans Latinas in the Bay Area, the Health Education Council in Sacramento, Latino Health Access in Orange County, Cultiva Central Valley, Esperanza Community Housing in LA, the Center for Community Advocacy in the Central Coast in Salinas, the Latino Coalition for Immigrant Justice, and Vista Community Clinic in San Diego. Thank you to the staff and leadership for their collaboration. Okay, so we're going to go into priorities by region, but overall across the 8 different regions, there were 3 overarching themes that we found rose to the top, and those were healthcare, mental health, and cost of living. These really, it's not a surprise. Of course, a lot of the questions that we're asking are around how people are interacting when they show up at their doctor's office, when they're enrolling for health insurance, et cetera. But we're also learning a lot about, how COVID-19 is still impacting folks' mental health and ability to live full lives. Additionally, some of the policies and imminent threats to our community are taking a toll on emotional and behavioral well-being. And lastly, with rising inflation, a housing crisis, and just the cost of living was absolutely one of the top 3 themes. So we'll hear about some folks' experiences over the next hour. Next slide. So our method of engagement is really a 2-prong approach. I mentioned already the small group discussions that we have, but before each of the sessions, each participant also fills out a demographic survey before the session. And through the survey, we learned that most of this last year's participants were largely comprised of cisgender heterosexual women with 79.7%. Lots of middle-aged folks with the highest concentration being between the ages of 45 and 54. More than half indicated having an annual income of $10,000 or less. And that really painted, a picture of how folks are struggling to make ends meet. Approximately 20% of participants reported having completed middle school, 19% reported having reached the end of elementary school. We also found that almost 40% have worked multiple jobs in the past year to be able to support themselves and or their families. And I mentioned, we asked some questions around how folks are experiencing the expansion of Medi-Cal thanks to Health for All. We learned that a majority are actually enrolled in full scope Medi-Cal at 64.6. So this is just a summary of some of our demographic findings. We will be releasing fuller research briefs later this month, so look for those in your inboxes. For now, I hand it over to Ariana to get us started with the regional findings of the Central Coast.
Thank you, Rosa. Good afternoon, everyone. My name is Ariana Sagun, and I was one of the research coordinators for this listening tour this year. And to start off the data briefing, we will start with the Central Coast. And we worked with the Center for Community Advocacy, Salinas, and the 3 top health priorities identified in this region was priority 1, healthcare, priority 2, cost of living, and priority 3, education. And to go in depth into each of those, within healthcare, participants discussed the limited access to quality, linguistically, and culturally competent healthcare and social services. There was some positive experiences with patient-physician experience among the Spanish-speaking community, but this is really specific to Indigenous communities, whom Spanish is not their first language or they have fluency in, and therefore face high discrimination, primarily due to language barriers and anti-indigeneity. The shortage within these qualified interpreters, especially in these rural areas, further marginalize Indigenous populations, making it very difficult for them to access and navigate healthcare services. And they also spoke about, in particular, one advocate within this group is going in and trying to translate these services, and they're just really feeling that her community is being discriminated against and very difficult to navigate healthcare services. And within the second health priority, the high cost of living and unstable employment really exacerbates social determinants of health, especially within food cost and housing costs, really creating stressful situations for families. Again, we see this population in the Central Coast where the majority are agricultural workers who have limited or unstable employment situations as they are dependent on the needs of the season or by crops, right? And many are forced to work into different sectors and multiple jobs in different sectors to financially support their family. And really the concerns with unpredictable rent increases, and one way to really mitigate those high cost of housing is to enter into shared living situations, leasing their space in their homes, not just to their own family members, but to like other people, outside community members who aren't family, and really creating these stressful, cramped living conditions, and are unable to and this can increase different health issues, especially during times like the flu or any COVID potential upticks. Participants also expressed, within the priority of education, that they would like to see more culturally and linguistic competent educators in the educational system in Central Coast. They express that their students need, they want their students to feel culturally represented and within their language as well. And in particular, one participant pointed out, right, that they see a lot of these teachers or immigrant teachers from Latin America working in the fields, right? And they really want to see those opportunities or a pipeline where these licensed foreign professionals can educate their children here in the United States, as they feel that would really support them in diversifying the workforce and could support their student success and increase parent participation in their students' learning, because that will eliminate those barriers to language. Next slide, please. The next region we'll be covering is the Central Valley, in which we worked with Cultiva Central Valley. And the three top priorities in this region was the cost of living, number 2, healthcare, and number 3, mental health. Within the cost of living, participants expressed, that the rising cost of groceries, housing, and utilities make it really hard to live healthy lifestyles, and they're struggling to make ends meet. Families in this situation, due to inflation, see the need to shop for groceries at convenience stores, or even opting out for fast food restaurants, because that's just more affordable for them than sometimes going to the grocery store and buying, fruits and vegetables. Multiple participants expressed that, they are trying to work enough hours to be able to afford a healthier lifestyle, to pay for housing and utilities, but oftentimes they find the need to reduce those work hours to be able to meet the income eligibility requirements to access, like, for example, CalFresh or Medi-Cal that can continue supporting. So it is like really a trade-off that they're experiencing within this, and there was a lot of frustration, right, among participants struggling to acquire healthcare coverage, just due to those income eligibility thresholds that aren't necessarily accounting for the necessary expenses and day-to-day expenses of these families. Within priority 2 of healthcare, participants in the Central Valley expressed that there are a lot of unmet needs as it relates to access and quality of care. Among the general concerns is the lack of availability of appointments, long wait time at clinics, and the need really to access specialty care providers in closer proximity. Due to the rural, area, a lot of the times they're sent to other cities to access specialty care, and that is like a long drives, and that would result in losing a day of work, which really is not something that many families can afford to do, especially in this region of the farm workers, such an essential yet very vulnerable population in the Central Valley, who often endure unfavorable working conditions, including extreme heat, exposure to pesticides and contaminants, and working strenuous labor. Therefore, within this group, participants agreed that there needs to be an emphasis and crucial need for this population to have access to affordable healthcare, quality healthcare. And within the third priority of mental health, participants in the Central Valley expressed that there needs to be increased providers, right, and resources for the Latina communities, especially among the youth. There's still a stigma, right, that our participants express and associated with seeking mental health resources, yet it's such an urgent need. And a lot of the times they see that people are getting help only once there's a crisis involved. And community members in this region explain that oftentimes crisis mental health resources are actually linked to police departments, and therefore that discourages individuals from seeking help because of the fear that the police department will be instead create worse conditions instead of de-escalating a crisis situation. And among the youth, they are seeing more violence in schools and gun violence threats, and parents in this case emphasize that there needs to be growing mental health resources to mitigate that stress. And next slide, please. In the next region, in Los Angeles, we partnered with Esperanza Community Housing once again this year. And the 3 priorities identified in LA is healthcare, housing, and healthcare in regards to different services such as mental health and access to oral healthcare services. The first priority in healthcare, our participants in this region expressed that they are seeing an increased access to care due to Health for All, but there are still challenges, right, with enrollment, quality of care, and language access. Participants wanted to acknowledge the significant improvement that they were experiencing with patient-physician communication interactions through Spanish-speaking providers and quality of interpretation services. So they actually noted that when a lot of community members had restrictive Medi-Cal, those changes once they were able to have full scope Medi-Cal and how they feel more respected and that given more attention to their health needs. Regardless, though, they do note that a lot of community members are still navigating this complex system of enrollment. So really emphasize the need of community health workers or promotores to mitigate the complex Medi-Cal enrollment system and really try to connect as many community members to Medi-Cal support. Within housing, Los Angeles is experiencing high housing costs that create dire situations for already struggling families in the region, right? A lot of our participants pointed out that, housing is at an all-time high in Los Angeles, and it just keeps increasing. Many families are already living in crowded homes, converting communal spaces into sleeping areas to be able to afford rising costs. A lot of these families have been living like this for years, right? A participant expressed, when the children were young, it was easier to all sleep in one bedroom, but as they're growing up as teenagers, as an adults, now it's creating situations where they're, have restrictive levels of privacy, causing discomfort and increased stress levels among all members of the family. And, there's no support from housing programs administered by county agencies because these are just inaccessible due to the extensive wait list for these housing programs. And within the third priority, really emphasizing the challenges in navigating mental health and oral health care services. So participants shared stigma associated with asking for help when it came to mental health, again, because of that stigma within the Latina community, but also just the limited access to those types of services in their communities. Now, in regards to oral health care, most participants associate that with high out-of-pocket cost, and therefore really don't, and having Medi-Cal oftentimes doesn't cover the services that they need when it comes to oral health care. And due to that lack of affordability of oral health care in the United States, many individuals seek more affordable resources and services outside of the country, usually their place or their country of origin, and they take advantage of just getting any oral health care work that they need there. Next slide. Now we'll go look into Orange County, in which, once again, this year we worked with Latino Health Access, and this was one of the sessions that was hosted in person. And the 3 priorities identified is healthcare, priority number 2, quality of care, and priority number 3, mental health. And within priority number 1, once again, we see that Medi-Cal expansion was celebrated among the participants, but again, really emphasizing how income eligibility requirements pose challenges, right, for community members to access a lot of these services. Several participants shared that they felt that there was a false hope, right, when the news of the expansion was shared, leading people to believe that everyone would have access to Medi-Cal regardless, right, of immigration status. But yet we see that even though that removing immigration as a barrier was definitely very helpful, a lot of families and individuals are still being left out because of the important requirements or the income eligibility requirements. a lot of them experienced that, like, shared, right? Even if they surpass those eligibility parameters by like slightly or just a little bit or a couple $100s, they're already excluded from getting access to Medi-Cal. We see again this narrative of participants or individuals having to reduce working hours to avoid losing healthcare coverage that they already had. And really that, again, that trade-off for families, but creating different financial barriers to cover basic needs for families. Within priority number 2, participants expressed the need to have improvements in the quality of healthcare and supportive social services among vulnerable populations. They noted that providers need to be dedicating more time and attention to the healthcare needs. A lot of the participants in this session expressed that either appointments are scheduled too far out in advance during the visit, or during the visit, providers are not, they're waiting long hours in the waiting room, and when it comes to their turn, they're like with 5 minutes with the health provider, and oftentimes they don't leave with clarity, right, in regards to the health concerns. One participant shared that she oftentimes prioritizes home remedies to treat specific health issues in their family before even seeking healthcare services, just because of that satisfaction of just waiting and not really getting their answers when it comes to access to care. They really want to see more support in navigating these resources. And lastly, within mental health, again, a strong need for expansion of services and resources to address diverse communities. We see once again that's the narrative of a stigma associated with seeking mental health services among the Latina community. And participants alluded to this stigma that has been ingrained with them since, being children. It's like, you don't need a therapist, nothing's wrong with you. So then therefore, as adults, it becomes very difficult to overcome this mindset and seek support, right, to be able to support their overall mental wellness. And based on these experiences, participants express that they can really benefit, or community members can benefit from different interactive activities, which, CBOs such as Latino Health Access can offer, such as those free wellness classes and activities that allow participants to engage in culturally competent stress relief activities. Next slide, please. And the last region I'll be sharing with you all is the Inland Empire, in which we once again worked with Latino Coalition for Immigrant Justice. And this session was also hosted in person in San Bernardino. And the 3 priorities in this region was healthcare, priority number 2, nutrition resources, and priority number 3, mental health. And within this region, for the first priority area, several participants acknowledged the latest Medi-Cal expansion, again, is a significant success for undocumented Californians. But once again, those income eligibility thresholds are to remain too restrictive and exclude a lot of low-income populations from accessing care. And many shared that they have been recently deemed ineligible for Medi-Cal, despite limited working hours or not working at all, but also not getting their questions answered as to why they're not even eligible for Medi-Cal anymore. We see this narrative again of forcing to adjust their work hours to remain eligible for Medi-Cal, and a lot of community members express the fear of their Medi-Cal getting taken away, especially because they need those essential healthcare services to address their needs. Within the nutrition resources challenges, again, it comes into play those income eligibility requirements that really restrict community members from accessing programs like CalFresh to support food resources. And in this case, Promotoras in the session provided context that they help a lot of community members access different food resources, such as community food distributions and mobile food pantries, so that families can supplement their weekly store-bought groceries. So for example, maybe getting their vegetables from these pantries and then buying proteins at the grocery store. And so really emphasizing the need and that a lot of Californians are still left out of these safety net programs because of those income eligibility parameters. And lastly, within the mental health, participants again expressed that they're severely limited with mental health resources in the Inland Empire, and actually pointed out that the county lacks prioritization of communities' mental health needs and only provides services as the last resort measure. And Promotores, for example, highlighted that they are frequently referring community members to different mental health services and resources, yet there's such a limited capacity to address the demand that they're seeing in their communities. So they really emphasize that these mental health resources need to be assessed and addressed in a timely manner to be able to support the individual's mental health, right, before they could lead to any long-term consequences. And that ends my section of this data briefing. I'll turn it over to my colleague Domingo. Thank you.
Thank you, Ariana. Hi, everyone. Whoops, excuse me. My apologies. Hi, everyone. So good afternoon. My name is Domingo, and thank you for joining us today as we present our findings from our 2024 listening tour. Again, my name is Domingo, and I was one of the resource coordinators, and the areas I covered were the Bay Area, Sacramento, and the San Diego regions. So for the Bay Area, we partner with ELLA, or ELLA, para Trans Latinas, it's an organization that advocates for trans women in the region. Through our listening session, we received significant feedback from people about the issues that impact trans Latinas and their health, and we identified 3 primary areas of concern, which are cost of living, quality of healthcare, and issues with discrimination. So for the first priority, cost of living, people shared their stories of the financial pressure they were feeling. Folks talked about their challenges in finding affordable housing. Folks also talked about having to work multiple jobs to achieve financial stability. 2 participants in the group actually shared that they had to resort to sex work to make ends meet. Individuals also expressed their frustration over facing higher taxes when working more hours. Increased income put folks at risk of being disqualified from vital food programs like food assistance. And thus, in their attempts to strive for a better future for themselves, the economic and support systems appear to have counterproductive effects in their efforts. The second priority was quality of healthcare. A few participants praised their doctors and clinics. They appreciate it when doctors would provide timely care and follow-up, or when they would have clear communication, especially when services were provided in Spanish. However, most people expressed dissatisfaction. They felt their concerns were overly oversimplified. Some participants noted that providers often made assumptions about their care based on their gender identity. One participant shared feeling pressured to undergo a procedure that they did not want. Another reported a doctor being rude, vulgar, and outright transphobic, which is completely unacceptable, especially in a healthcare setting where folks are supposed to go for care, receive care, not abuse. And this is actually a good segue for the third priority of this region, that being discrimination. As demonstrated by the last example, discrimination remains a major area of concern for the trans community, whether it be in the healthcare settings, to workplaces, to educational settings, and even housing. In healthcare settings, a participant reported undergoing and receiving experimental treatments without proper informed consent, which is a serious violation to their bodily autonomy. In the workplace, one participant described being a target of disparaging remarks and being assigned tasks that were deemed quote unquote appropriate for their gender, and also being denied opportunities for dignified work. In educational settings, participants shared feeling marginalized and excluded from opportunities to learn, which keeping them fully from participating in the educational setting. Moving on to the next region covered, which was Sacramento. Our Sacramento research was conducted in partnership with the Health Education Council and their Ventanilla de Salud program. Our research revealed 3 areas of priority within the community. These 3 priorities include healthcare, cost of living, and mental health. The first priority was healthcare access, where folks, even folks with insurance, struggle to afford essential care. Some participants shared that insurance coverage pointed out that even with insurance, affording necessary medications or specialty care attention like mental health therapy or oral health services is difficult due to limited coverage. Quality of care issues persist throughout the system. Participants highlighted other challenges that include the lack of timely referrals, delays in scheduling specialty care visits, appointment cancellations, and gaps in follow-up care. Numerous participants shared collectively that shared their sentiment that their health concerns were not being taken seriously. Language barriers also remain a significant challenge, especially during the initial front desk interactions. Our second priority in this region is the cost of living. The high cost of rent is a significant challenge for many participants, including those with multiple jobs. Limited affordable housing inventory forces families to compete for scarce options. For those working numerous jobs, they report that taxes create a barrier in experiencing upward mobility. Participants also highlighted that California wages weren't keeping up with the living costs that they were experiencing. On multiple occasions, participants also noted having to make the choice between purchasing groceries or paying the rent on time, which is quite unfortunate. Some participants sought resources like CalFresh benefits. However, full-time individuals often face difficulties qualifying for food assistance due to the income thresholds, even if they struggle to afford groceries. Moving on to the third priority for this section, which was mental health. Folks shared that cultural stigma continues to prevent many from seeking mental health support. Participants emphasized the importance of continuing to break down the stigma associated with mental health issues and increasing the availability of culturally sensitive services. Participants also shared that locating a provider was a challenge, which was further complicated by the limitations of insurance coverage. Some parents with children that suffer from severe mental health illnesses such as schizophrenia described the complications of finding age-appropriate care close to their home. Participants also noted the lack of clarity from insurance providers about what is covered versus what is not covered under their policies. Parents in the group highlighted the need for increased mental health support in schools, particularly given the rising rates of suicide and mental health challenges among youth. The suggestion was made from the group that schools should have dedicated mental health support teams to provide early intervention assistance to students. And then moving on to the last region, which was San Diego County, we partnered with the Vista Community Clinic to conduct 2 listening sessions. One was conducted with a Spanish-speaking group, and the other was conducted in Maya Canjobal. Maya Canjobal is an indigenous language spoken in Guatemala and parts of Mexico. From our 2 sessions, we obtained 3 areas of priority, which include concerns with the cost of living, healthcare, and language access. With regard to the cost of living, once again, cost of living was a major area of concern. Folks raised concerns of having no choice but to share an apartment with other families due to the lack of housing. Participants also recounted that people sleeping on the couch, on couches or on the floor was a common occurrence. Participants also commented that living in these crowded conditions has had an impact on their mental health, with the added stress and conflict of having to share space in overcrowded living conditions. Folks also shared their worries about the rising cost of fresh produce and struggles with affording medical expenses. Many found that their income hardly covers their rent, leaving little money for other necessities like food. Folks in the group did note their appreciation for food distribution programs that provide access to fresh produce, like those offered by Poder Popular in the North County region of San Diego. The second priority was healthcare. Given the proximity to the border, some participants mentioned opting to seek dental care, for example, in Tijuana or in other border cities where costs are lower than in the U.S. Additionally, some participants shared their frustration about how income-based qualifications for programs like Medi-Cal can be so stringent that a slight increase in their income can lead to disqualifications from such programs. The complexity of navigating the healthcare system was another challenge that came up. The lengthy process of obtaining medical insurance and the numerous forms and documents required prior to receiving care actually end up creating a barrier to the care itself. This is especially notable for folks who can't read or write or don't speak English or Spanish. And then our third priority from this region was language access. Both the Spanish and Canjobal speaking groups reported insufficient access to interpretation services. Many participants noted the challenges in communicating their needs to service providers in their native languages, and conversely, struggling to understand their service providers when receiving information from them. As a result, some individuals resorted to bringing a friend or family member to their appointments for translation, a solution that is not always ideal. Additionally, many participants highlighted the lack of materials or information available in their native languages, forcing them to rely on information only in English or in Spanish in the case of indigenous folks who speak neither. Consequently, many participants were unaware of the services and resources available to them in their communities. So with that, that wraps up the summary of the regions for which I facilitated a listening session for. I'll pass it on to Mar.
Thank you, Domingo, and just want to take a quick second to just thank the entire LCHC programs team and everyone who put in their little bit of arenita, right, to make this happen. So thank you all so much. Hi, everyone. My name is Mar Velez, Director of Policy with LCHC. I'm here to share with you all a preview of our 2025 legislative and budget priorities. As many of you might know, the deadline to introduce legislation isn't until next Friday, February 21st. So there might still be some really great bills that we might prioritize, but this should give you all a good sense of what we're prioritizing for this year. And just want to take a moment to say that, you know, we heard a lot of the challenges, right, that our communities are experiencing. And we know that we're advancing certain legislative priorities, we're advancing certain health policy and budget investments. We know that that's not enough, right? And so we want to reach out to you all, extend our hand and say, let's work together to make sure that all of the priorities that we heard about, all the challenges that we heard about are being addressed. So want to provide that invitation to you all as we get into the priorities this year. So let's go on to the next slide. And with that, I just want to reiterate what our executive director said at the top of the call. You know, LCHC, we're committed to safeguarding Latino and Indigenous health. We've been active in so many amazing campaigns that have made California the state that it is, right? Welcoming to immigrants, one of the most diverse state in the country. And so California must uphold, you know, we must uphold our progressive values. We must hold our elected officials, our offices accountable to make sure that we continue to provide what is needed so that our entire state thrives. So I really welcome and appreciate every single legislative office that's on this call today, because we want to partner with you. We want to continue building a California that's equitable and that's strong and that's healthy for everyone. Next slide, please. So with that, let's get into our legislative and budget priorities for 2025. At LCHC, we have 3 areas of focus in terms of our policy. The first one here is health access and health equity for everyone. Under this area of focus, under the legislative priorities, we have AB4, authored by Assemblymember Arambula, which you all should know as Health for All. We've made amazing progress here in the Medi-Cal space, right? Just last year, you know, starting in January, anyone, regardless of immigration status, is now able to access the Medi-Cal program as long as they're income eligible, right? That's amazing. We're really closing that health access gap by expanding. Now, you heard in the findings a little bit ago that many folks, although they are, you know, low income, although they're struggling to pay for things like groceries, they still make too much to qualify for Medi-Cal. So they unfortunately are over the threshold. If you are over the threshold, you can then you know, access healthcare coverage through Covered California and obtain affordable healthcare coverage. Unfortunately, that is not the case if you're undocumented in California. That barrier still exists within Covered California. AB4 would initiate the process for us to start removing immigration status as a barrier. As we know, healthcare is a human right, and anyone, regardless of immigration status, regardless of income, should be able to access healthcare. So we will be prioritizing AB4 this year. In addition, we will also be prioritizing and co-sponsoring AB 403, authored by Assemblywoman Liz Ortega, the CHWPR Medi-Cal Services Transparency Bill. Now, I'm not sure how many folks know, but it's if not, we're so thrilled that as of July 2022, if you are a Medi-Cal recipient, you can actually access promotora, or community health worker services. We know how effective the promotora and community health worker model is in terms of providing effective care that's in language, that's in culture, that is really able to reach our communities. It's amazing that you can access that through Medi-Cal. Unfortunately, since this benefit has been available, less than 6,000 Medi-Cal recipients have accessed this amazing benefit. We need more information around how this benefit is performing. So AB 403 would require DHCS to publish an annual report on the utilization of the Medi-Cal benefit for the CHWPR Medi-Cal benefit. We would get information on utilization, on the workforce, how many promotoras are being hired. We know that promotoras and CHWs are often immigrants, low incomes themselves, Latina, women of color. How many are we hiring through Medi-Cal? How can we increase that number to make sure that more Medi-Cal beneficiaries are actually accessing this benefit? This is important information to be able to really see the potential of the benefit and make sure that all of our communities are healthy. So that is AB 403. On the budget side, we are prioritizing protecting Medi-Cal coverage or continuous coverage. As you all know and heard a little bit in the presentation, many people were disenrolled during the unwinding, right? That renewal process was paused for 3 years during the pandemic. It began last year. It restarted last year. And unfortunately, many people lost their coverage because of systemic glitches. Folks had submitted and updated their income information. The system did not register that. People didn't know about the yellow envelopes. The envelopes weren't always yellow. There were a lot of issues with the unwinding process. So what we do know is that federal flexibilities were really successful in keeping people on their Medi-Cal, right? We were able to do that during the pandemic. We know that this is effective. People need to stay on their Medi-Cal. Making those federal flexibilities permanent is going to help keep California healthy. So we will be prioritizing continuous coverage, protecting Medi-Cal coverage. And then we also will be prioritizing rate increases for promotoras, going back to our promotora workforce. Again, effective health equity model strategy. We need to pay our promotoras what they deserve for all the amazing work that they do. Last year, the rate increases were actually included in the budget. Unfortunately, there was a caveat that if Prop 35 passed, then that increase would be, that budget investment to increase the rates for promotoras would be rescinded. That did happen. So we urge California to restore those rate increases for promotoras. So we're asking for a $5 million general fund investment. That sums up health access and health equity for all. Let's move on to our second area of focus. Next slide. So again, health access is important. We need folks to be able to access care and quality care, but we know that 80% of our health outcomes are based on the social determinants of health or our external factors. So under this area, we're going to continue prioritizing food for all, so expanding access to nutrition benefits regardless of immigration status. Done a lot of great work in this area. We've advanced this campaign, and thank you to the leads, the Food for All campaign. We have 55 plus, right? Will go into effect October 2027. Yet we need the rest of the population, regardless of immigration status, to be able to access nutrition benefits. So 54 and under. So we will keep prioritizing this for this year. And next slide. And then finally, we have our health as a human right area of focus. Under this specific bucket, we have some really important legislation that is going to protect our communities. We know that this year, the next few years are going to be challenging for our immigrant community. And so we need to prioritize legislation that's going to keep us healthy and safe. So here we have SB 81, authored by Senator Areguin, health facilities and information sharing. So Here we will want to protect health facilities and clinics, including mobile clinics, from immigration enforcement. Unfortunately, the federal government has, removed or started threatening health facilities so that ICE and immigration enforcement can enter. We don't want that in California. We don't want our community to fear going into their clinic, to their hospital, et cetera, to get the care that they need. We need to protect our health facilities. So SB 81 would make it so that our health facilities don't have to work with ICE, right? And protecting as much as possible our information, et cetera, when accessing healthcare services. So that is SB 81. And then SB 12, authored by Senator Elena Gonzalez, Latino Caucus Chair, Immigration and Refugee Affairs Agency. This bill would create the California Immigration and Refugee Affairs Agency, really trying to streamline all the great work that's happening to protect and provide services for our immigrant community. This agency would really coalesce all of those efforts so that there is one specific agency that is addressing and moving forward these efforts. So that sums up our legislative and budget package. I will turn it over to Rosa to see if there are any questions.
Thank you, Matt, for tying it all together for us with our legislative and policy priorities. And to our two coordinators who did a wonderful job synthesizing all their data and really hitting key points. Now we have 4 minutes for questions if there are any in the Q&A. Earlier we saw one around access to slides, and our team will be sending out slides, this recording, and copies of our full briefs after this session through email. Okay, so yes, that answers Vilma's question. The slides will be available. Denise Jimenez, maybe this question goes to Mar, has, what is the best way we can get involved in supporting these bill/legislative efforts?
Yeah, thank you so much for that question. I think by you being registered today, you will definitely receive updates from LCHC regarding our 2025 legislative and budget priorities. I can tell you right now that we're going to need as much support as possible, just because in the legislature, as well as with the governor, there are a lot of competing priorities. I don't have to, share with you all of the things that happened just in this last month and a half alone with the LA wildfires, with trying to protect our communities from all of the overwhelming, right, and changing federal sort of executive orders, et cetera. So we have to work together. I think at the end of the day, we want to make sure that we get as much as possible to address as many of the challenges that we're facing. So really appreciate that question. We will be sending out updates on how you can support each of these pieces of legislation and budget investments. And that could look like, submitting an organizational letter to support legislation. It could also mean we have social media toolkits that we provide for each of these priorities that you can tweet out to the governor, tweet out to specific legislative officials that have that decision-making power to make these initiatives a reality in California. So appreciate that really important question. We will keep you updated.
Thanks, Matt. There is one other question, and we have 1 minute, and it's a big one, but it's around the impact to federal funding. So just given the potential federal funding pause and the decreases in benefits like Medi-Cal and CalFresh, what are ways that community advocates and agencies can be proactive and dynamic with all this while keeping the collective priorities aligned?
That's a great question. I think about the continuous coverage fight last year. As you saw, we're prioritizing continuous coverage again for both adults and children, right? We wanted everything, and we ended up getting at least children 0 to 5. But unfortunately, because of other sort of priorities, that was also eliminated from the budget. But that's why we need to, have conversations now, because our children, they need a continuous coverage. They need to continue accessing healthcare. And we, again, those competing priorities, but let's have conversations, let's work together so that, again, our communities can have everything they need, and that we can work together to provide all of that.
Thank you so much, Magda. I don't see any other questions, but if you can share our contact information, our slide support, you can reach out for more information on the Nuestras Voces, Nuestra Salud community listening tour, any of the data that was presented, the partners. Please reach out to me directly. And if you have questions or want to partner on any legislative and budget priorities, please contact Matt directly. Our emails are on the screen. We really appreciate all of you who took the time to join us during your lunch hour. It is 1 o'clock, so we won't take more of your time. Please follow us on social media if you don't yet, to stay tuned to all of our wonderful work ahead. Hope you have a great rest of your day. Thanks for joining us.